not like a game, but more so like hunting prey. I don't know that. That's actually pretty cool. So hopefully that would be a mechanism at your site, because that would be weird. Chickens running around.
Gross.
So gamekeeper's thumb is forced abduction, ulnar collateral ligament sprain, and then skiers, football and basketball players can get this as well. Hunters, I guess. I think this is pretty self-explanatory, and because it's a collateral ligament, you can test it using a valgus stress test. A swan neck deformity is this particular situation: boulder plate injury, middle phalanx, fracture, malunion, and so on and so forth. So these are the types of things that can make you present like this. Okay, now that looks like boutonniere. Okay, but this is a contracture. Okay, so your finger is stuck like that. Flexion of the metacarpal phalangeal joint and the distal. So it's flexed there, and then extension up here. Okay, sorry, it's the opposite of a boutonniere deformity. With a boutonniere, it's extension, extension, and then flexion. So it's the complete opposite of a boutonniere. Right, so a boutonniere deformity, you're extended here, extended there, but flexed over there. Again, the flexion comes from the destruction of this tendon. Okay, we have a couple more slides, so we'll finish a little bit early. Phalanx sprains. Sorry, that's not accurate. What should it be? Phalanx is the bone, right? So, interphalangeal joint sprain is more accurate. Interphalangeal joint sprain. Forced abduction and adduction at the interphalangeal joints. Ruptures of the ligaments. Angulation. The one thing, again, be careful. You might want to put a star on this slide. Fractures. Especially if it's angulated. In these particular situations, not a good idea to reduce. Okay, so as a therapist, unless you have standing orders, you can try, but generally if it's angulated laterally, then it's probably not a good idea to reduce. They need x-rays. The last one is joint contractures, and this can occur either in the DIP or PIP joints. Joint capsule tightness versus intrinsic muscle contraction. Now there's a couple tests here. Funnel Littler test and retinacular test. We'll go over this again. This is probably the most confusing test with respect to the hand, wrist, and fingers. And with respect to this test, all you're doing is having them flex and extend their finger with this joint, the PIP, flexed or extended. Okay. So I know it's towards the end of class, so it might be tough to digest this, but let's just say that their finger, and you can do this with yourself, is if you keep your finger, your PIP joint fully extended, and you flex the distal one, and imagine that there's a restriction. It's like it's limited. You want to know whether or not the limitation is because the tendon is in a contracture or the joint capsule is problematic. So is it a capsular issue or is it a joint contracture? Because then that'll tell you what to treat. If it's a tendon issue, joint mobs isn't going to do anything for you, right? If it's a joint capsule issue, then you want to do joint mobs. Okay, so if your finger's extended and you're flexing your DIP and you're like, okay, well, it looks a little limited. If you flex the PIP and then wiggle around that joint again, if you get more range of motion, what does that tell you? Is it tendon or capsule? That's when it gets confusing. So if you extend everything and flex the DIP, you're like, okay, take that as a baseline, let your finger relax and bend it, and then flex that finger again. If you have more range of motion now, is that a joint issue or a tendon issue? What do you think? How many people say tendon? So first when you do this, and you're like, okay, it's limited. And then you bend your finger, relax your finger, and you bend it again, and now you have more range of motion all of a sudden. Just by bending this, you have more range of motion now. Is it a tendon issue or is it a joint issue? How many people say tendon? How many people say joint? Okay, that over the last few years has been a relatively difficult concept. So it's actually a tendon issue because you just loosened up the tendons and allowed the distal joint to move further. What do you think you would see if it was a joint issue? It'd be the same. Regardless of what position or how much bend it is in all the other joints, it would still be limited up here, it'd be limited here, it'd be limited here. Now, does that direct your treatment, though? Okay, it would. If it's a joint problem, you have to do most to improve the range of motion. If it's a tendon issue, you might have to do some tendon soft tissue work. Frictions, ultrasound, deep tissue release, ART, something along those lines. Okay. But that's the Littler and retinacular test. We'll do that again. Okay. I was just hoping that you guys are comfortable with that concept. Okay, so any questions about joint contractors? The last checkpoint. Okay, so this is the last one. Acute axial load on the finger causing a deformity, which is the most reasonable iOS. Okay, so try that one out. Acute axial load on the finger causing a deformity, which is the most reasonable iOS for this mechanism of injury. Axial load on the finger causing a deformity. Okay, so again, you have to go back and figure out what these are and see if they match.
When I sit down to watch TV, I don't watch it.
If that's what kids call it. You kids?
I'm sorry, how old are you?
But it's so much more dress. Like just in case. Apparel. Okay. So are you going to take it? No, you don't have to.
Okay, last group. Who wait for? Yeah. Okay, Sasha, take a guess. I'll show you the answers, but we'll talk about it on Monday. Well, if you feel like you may not be able to get some sleep this weekend because this will be hovering in your heads, then we can quickly talk about it, but it's 10 to already. I don't want to keep you. We're waiting for one more. All right.
I just want to know.
Oh. Okay, so there is a discrepancy here. You want to talk about now or wait till Monday?
Yeah.
I actually don't know. We talk about it and I'm like, okay, that makes sense.
Who is this guy teaching you?
Okay. Lots of practice.
You can text the person, or you text the number, or you search the number.
Okay, I would say it's this one. Question is, what here does not belong? Axial load on finger causing a deformity. Could be boxers. Yeah, but it doesn't say exactly what deformity is. It says deformity job. So, but that's a good point, right? So boxers could be the one that's not right here, but something else is not right. Possibly. Well, actually, no. I'm sorry. It's mainly boxers. I was going to say swan neck. Okay, but swan neck is a contracture that results later on, but the swan neck can result later on as a result of that as well. So this is more correct.
Then would you see a phalanx fracture?
A phalanx fracture,
Yeah.
potentially. It could be an angulated fracture. Right. I mean, you'd see it at the joint more than the shaft, but. So, is there a right or wrong answer? No, there's a better answer, but again, it depends on how you rationalize it. Okay, so there are some reasons why this is right, but there's some reasons why it's wrong, and vice versa. Okay, but as long as you understand that, then we're good to go. Do you guys have any questions before you guys go? Okay, let me get out of here. Monday, I'll see you guys on Monday, 8 to 10. And Mount Royal, you guys are cleaning this week, by the way.